It's my pleasure again to introduce Dr. Natalie Truba, who is a clinical psychologist from Columbus, Ohio. Natalie made the drive up here for the weekend, and we really appreciate her input. She's got another session for you, which is going to be on understanding and managing experiences of anticipatory anxiety and grief. So Dr. Truba, the floor is yours. Thank you.
Well, hello, good afternoon. Glad to be back again today to talk about something that I'm really passionate about, which is understanding really complex human emotional and behavioral and thought experiences. So this is a pretty general talk. It's not specific to Duchenne by any means. And so my hope is that as parents, as kids, if you're here as a child or as a young adult, or as somebody who cares for people that are neurotypically developing, that you will take something away from this talk. So I'm going to be talking broadly, so please ask specific questions at the end if you have them, or reach out by email. So I'm going to quickly touch base about something Nicola asked yesterday. And so for newly diagnosed families out there, when we're talking about isoforms, what we're talking about is the DMD gene codes multiple protein isoforms. So one of those might be DP427. There are other ones, and they differ in length. And this is a slide PTC and I put together a while back for a parent series talk that we did for newly diagnosed parents. And one way that we thought about this when we were thinking about putting this talk together was kind of thinking about it like a train. And full-length dystrophin, 427, full-length, has the front of the train car, and the caboose. And each subsequent sort of isoform in this form shows you the varying length down to DP71, the shortest isoform protein, the shortest length that's most abundantly expressed in the brain. So another way to think about this is the full-length train car is expressed in the muscles in the body, and these shorter isoform proteins are expressed in the brain. All right, so now on to super fun stuff, and get ready to party hard because we're about to have some really fun behavioral learning. So I think it's always important to know kind of how I make my Kool-Aid before you start drinking it, right? So I'm a radical contextual behaviorist, so I look at all thoughts, feelings, and behaviors, physiological responses as behavior. So when I'm talking about behavior, I'm talking about these things, anything that we can observe, manipulate, and bring into experimental control. And in that way, it's really important to understand that there's overt behaviors that we can see, behaviors like yelling, crying, meltdowns, and there's covert behavior we cannot see. And that's how you as an individual or somebody as an individual might perceive, respond, and sort of contact internal processes associated with stimulus, external stimuli or internal stimuli for that matter. So we can't easily see those processes, but they're really, really important. And that's because all behavior is purposeful, even maladaptive behavior. So humans as creatures, we do not do behaviors that do not serve a function. It might not make sense to you. It might not be something you would do. It might seem like it does not serve a function, but humans do not do things that don't serve a function. When things stop serving a function, they are extinguished. We naturally just don't do those things. And this is really important because topography of behavior is those loud things. And that's what impacts life. And so if you're a provider, these are the things that people bring into clinic with them. My kid is hyperactive, they're impulsive, they're aggressive, they don't fall asleep well, right? If you're a parent, these are the things that you're like, oh my gosh, I want to pull my hair out and I just want to have a day of peace. The problem is that topography is really easy to describe. The DSM is topographically designed, right? So how do we know you have ADHD? Well, you're doing these things that we can observe overtly, and I come in and I tell my provider about them, and they're like, well, hot dang, that sounds like ADHD, here you go, here's your ADHD diagnosis. The problem is that when you have dystrophy, some of the drivers for these things are pretty different. And when we're thinking about how do we treat these things in neurotypicals, sometimes we kind of can make it worse in our dystrophy patients. And so it's really important to understand the function something serves, particularly with this group, and it's also helpful for yourself as a human. And so what you can get caught in is your topography. What am I doing? What do I notice? What are the things people tell me? And we really struggle, unless you're specifically trained, to understand how do I do that at an internal process to understand how things can occur together, chain together to create complex human behavior and why I'm doing anything in the given moment I'm doing. And in this vein, it's always important to talk about reinforcement and punishment sensitivities. So this is kind of the concept of what develops personality. And if you look at the personality literature, what you'll see is that personality is not a stable construct that stays the same for people over time. And that's because we are very malleable creatures and we are constantly changing. Reinforcement and punishment sensitivities are kind of what make you from an internal process. So the easiest way for me to talk about this is social attention. The act of receiving social attention is not different for any of us. I am somebody who likes that feeling that gives me when I have social attention. So I've kind of sought that out. I like to do talks like this. I've kind of put myself in positions to be in that space. I get adrenaline. I like that feeling of adrenaline. My brother's the opposite. He is shy. He does not like the feeling that he gets when he receives social attention. So he has self-selected and chosen to do other things. Our parents parented us a little differently because of that, even though we have very similar genetics. So we were perceiving and responding to that internal process of what it feels like to receive social attention different. And therefore our behavior selections change because of that. Sorry, one more thing I want to talk about. A good example of topography and function is crying. So if we put somebody in a box without any other stimulus around, and you see them crying, you might say, oh my gosh, they're sad. But we actually don't know what's driving the crying, because crying is serves a function of physiological release, but it also serves a communicative function. People cry when they're happy, they cry when they're sad, they cry when they're in pain, they cry when they're frustrated, right? So there's a lot of reasons why you might cry. There's a lot of things that drive crying. We use other things. We might notice, oh, other people are crying, their face looks sad. I know that they recently had a loss. So you might be able to filter that in and make some assumptions. But without that information, it's really hard to do, right? And so crying is a good example because it is something that serves multiple functions and that helps us understand as humans that we only have so many behaviors, right, that we can show really, really complex and internal nuanced processes that are happening in our body. So one behavior might serve multiple functions. And so you really have to understand the behavior that's serving in that particular context and in that particular moment, right, for you as an individual. And this is where it becomes important to understand things like reinforcement and punishment. And a lot of people throw around these terms and they feel like they understand them, and we don't. And so I'm going to do a quick crash course real quick. So by definition, reinforcement must increase a behavior, and by definition, punishment must decrease a behavior. So we do not determine whether or not something is reinforcing or punishment until we see the consequence of that thing, right? So it's not based on what you feel about it. Well, my child shouldn't want to be yelled at, so I'm yelling at them, so they should want to avoid that thing, so it must be a punishment. No, if you're yelling at them and they continue to do the thing, then it is by definition reinforcing, okay? So these are very, very scientific definitions, and it's very important because these are consequences. So the consequence that follows a behavior will determine whether or not it continues to occur or whether it stops. Okay, this is like the most basic level of analysis here from a behavioral learning standpoint. They both can be positive or negative, okay? Positive, something that's added. So for reinforcement, this would be a reward, like money. You do something I like, I give you money. You come to work, I give you money, okay? We could all agree you gotta go to work, you gotta do that thing, but if you quit getting a paycheck, you probably quit going, right? Because you're getting incentivized, even though we all would say it's an important job, we all have important jobs, okay? Punishment, pain, would be an additive, right? It's shock, okay? So two types of reinforcement, or two types of positives that can be in reinforcement and punishment. Likewise, negative, something's taken away, something's removed. So in reinforcement, this would be relief. So that really nice buzzing noise you get in your car, right, when you don't put your seatbelt on, that was designed by a behavioral person such as myself. And they were like, that's really annoying, so let's make it annoying so that to get rid of that annoyance, you have to click your seatbelt, okay? So that's a relief, right? And it actually works pretty well. Most of you probably, when you hear that ding, and you're like, oh, you put your seatbelt on, right? Punishment would be lost, something's taken away. This is how timeout works, okay? So this is why timeout's an effective punishment strategy here. Spanking is a good example of something that people think is a punishment because you should not want to get hit, right? You should not want to get spanked. If you continue to have to spank your child, then by definition, are we punishing? We are not. We are reinforcing. And if you're somebody that really, really, really feels strongly about punishing, the thing I'm going to challenge you to do, or spanking, the thing I'm going to challenge you to do, is to not spank when you are not, unless you're calm. So what actually the reinforcement paradigm that serves for spanking is a negative reinforcement for the parent. You're upset, your emotions are high, you spank and you feel better, right? And so it actually makes it more likely that you will spank because you feel better. It's not necessarily controlling the child's behavior. And if you don't believe me, I challenge you to try to do that when you are calm, and you will feel very differently about spanking. So how does this relate to thoughts and feelings and behavior? And how do we take these basic information about how do we understand and how do we start to analyze and understand our behavior and our kids' behavior into things like thoughts and feelings? Well, we do that in a way where we are understanding those antecedents, the stimulus, the response, the behavior, the thing that follows the stimulus, and the consequence. So ABC, right? ABC is a behavior. There's two ways to look at this. I'm going to talk about both. So the first one is a behavioral example. So the antecedent, you need to do your homework. The behavior is the child might yell or cuss. The consequence is maybe they're sent to the room, okay? So that's not appropriate. We don't have that behavior in the living room. You go to your bedroom. Okay, so we're like, I'm punishing them because they should want to be part of this and do their homework, and they're in their bedroom. But their bedroom's like kind of fun. They got stuff in there they can play, right? And so they're in there like doing their thing, and you're like, you're ready to come out and do their homework, and they're like, I don't know, maybe. Yeah, I guess I'll do it, because they also recognize that they need to do their homework. So they're kind of reinforced for that, right? So they get to avoid doing their homework. The other way to think about this is activating a belief about the event, right? And then a consequence to that. So an example might be your son melts down. Your thought is, he's doing this on purpose, and you might feel angry, okay? This anger is going to likely impact future behavior choices that you make either in the immediate future, right, or the next time that your son's socks melt down or has a meltdown about their socks, right? You might have been primed that you're a little bit more angry than you would be if it didn't happen all the time, right? This first one is negatively reinforced, right? The kid gets relief, they get the escape. So how we would teach to do this in timeout for a way that's beneficial is we would not have you send them to their room. We would have you do timeout in an area that is public, where they're watching other people enjoy the things that are fun, right? But not able to enjoy them themselves. So they might be able to watch people watching TV, but they can't see the TV themselves. And so it's like a boredom side of punishment. Nobody likes that. And then they still have to get back to the table and finish their homework. If they cuss, they go back to timeout. And so they're not getting removed to their room, or there's potential reinforcers, okay? So sometimes it's flipping that a little bit on how you're doing it, because we want to make sure that truly is a punishment paradigm in order to reduce the behavior. The second one is going to create context, right? So context in the way that you're going to react in the future. So when we think about specific emotions, we have to then take some step backs and understand in the moment, what are the things that might be controlling behavior, or what might be influencing maybe how that is manifesting. One of those things is language development. So like I talked about yesterday, we develop how we scaffold and understand our internal experiences through language, and language is trained and it's subjective, our emotions, and we use objective language that we can all agree on kind of means the same thing to describe internal experiences. So hurt versus ouchie versus boo-boo, for example, are three commonly used words for pain. In the hospital, I work, I'm an inpatient provider primarily, so I see a lot of kids who are very, very ill. And you would find it's surprising how often when you're trying to talk to kids about how they're feeling, that if you're using different words, they might deny symptoms that they might be having. So if you're a child whose parents use ouchie anytime you hurt like you fall and you scrape yourself, right? But when you're ill, they call that, they might say like your belly hurts or your head hurts. So ouchie is associated with a physical injury, like a scrape, a cut, a bump, and hurt is associated with an illness feeling. So if they're in the hospital and we're asking them about ouchies and they're saying no, well, they don't have scrapes. They don't have this. They may have different pain that's hurt in their head, right? Well, I'm not hurt. I don't know what that is because I don't have any ouchies, so I'm going to say no, right? And now we're missing out on information because we don't know the words that they've learned to discriminate these two different types of pain feelings, right, or illness feelings. This is an example of a feelings wheel that is simplified for children, right? So when we think of, this is a simplified one, okay, for children. So the ones, for adults where we pull out are much more complex, right? So when you're thinking about, when we understand what it means to feel scared, right, we want to expand that into other ways. So there's a lot of words, right, you can use to describe different types of internal experiences. The more access you have to those words, the better you are at parsing out those nuances of how you're actually feeling and thinking. Context is a second big one, okay? So on environmental factors, so environments control for our behavior, right? Like, so this is a professional environment. We've all wore maybe certain clothes because it's a professional environment. We're engaging in certain behaviors right now. You might be taking notes. You might be sitting quietly, right? If you're at school, then you would have different things that control your behavior. If you're a parent whose kid does things at home that they would never do at school, you're like, I don't know why you don't act like this at home. I wish you would act like you act at school at home. What you're looking at maybe is social control. So kids need to be motivated. All of us are motivated to do the things we're doing in any given moment. There are kids who are very, very sensitive to social control, right? So when that social control is in place, their peers, they will really, really, really put effort into doing things that keep them kind of receiving the type of social attention that they want, which is to be liked and not to have people think that they're melting down or XYZ, and that takes a lot of energy. So they might get home and not have that energy anymore to kind of put into that, right? Because they've used it all up at school. The other is individual variables. So all of you are likely parents or are familiar with children at a time. If you've ever had a younger kid learning to walk and they fall, your reaction to that is incredibly important, is it not? So if you're like, oh my gosh, are you okay? The kid's like bawling and they're crying, right? And if you're like, oh buddy, you're fine. They're like, okay, I'm fine. They're not any less hurt in the situation, but they're looking to you to understand, how should I be reacting to this, right? That's telling them, is this good or bad? You are the barometer in that situation, Okay, so other people can control our behavior as well. I act different in front of my parents than I act in front of my friends, than I act in front of my work colleagues, right? So that's always important. And these are all things that are happening outside of conscious awareness all the time, that are influencing why you feel, think, and do things in the ways you do. If you are somebody that's ever had a job that you've really hated, you might notice that you wake up in one mood, and as you get closer to work, your mood starts to change. Or when you walk in, you might notice, I feel tired, right? Your body learns stress responses based on context and environment as well. If you've had lunchtime at one time and then your lunchtime switches, you might notice you still get hungry at the old time for a while until your body has trained itself to send a hunger cue at a different time. So that hunger cue sent, it gets extinguished, right? Because you do not feed yourself. Your body kind of resets, and now your brain learns to send that hunger cue at a time now that it is going to get fed. It's reminding you, boom, and then the consequences that you're getting fed. If that consequence is removed, the behavior changes. That's true biologically as well. So that's classical conditioning, Pavlov's, right? That's the process there that was happening. I talked a lot about automatic neural pathways yesterday, and behavioral patterns, not behavioral patterns. So that's what we're going to talk about the rest here. And when I talk about that, we're talking about looking at things from a stimulus response in a chaining standpoint. So I'm going to take one specific emotion and kind of weave that in a minute. So when we're thinking about specific emotions, we always want to stop and say, is this a normal reaction to an abnormal event versus an abnormal reaction to an abnormal event, okay? The expectation, again, like I said yesterday, that we won't have difficult emotional experiences or different experiences that maybe can contribute to experiences of suffering is not achievable, because that's part of human condition. But we want to know, is what I'm experiencing normative? Is this a way that I should be experiencing this negative emotional reaction? Or is it more intense than it really should be? Or what I can expect it to be? So having a good sense about which place you're falling in is really important when you look at how am I doing, right? Because there might be times that you're like, I think this is a lot worse than I kind of be expected or anticipate it to be, and I might need more help, right? I might need more help than I can do for myself. And so if we think about how do we start to analyze and think about thinking and thoughts and emotions, we start to think about chain analysis and kind of walking ourselves through each piece. And this can be in any configuration, right? There might be an event, and then you might have an emotion, and then a thought, and then an urge, or you can have a thought, and then an urge, and emotion. So this is just an example of how things can chain together. But when we think about this, so if you're kind of like, why did my kid just melt down here? What helps is being able to go back and be able to chain all the events together and to understand, like, okay, well, like, what did I think about that when that happened? And then what did I do as a response to that led to here, right? And that can help you understand how you got here, because a lot of times we're operating automatic pilot mode, and we're not really necessarily fully aware of why we're doing what we're doing in any given moment, which is good. I mean, you would be exhausted if you had to be super on top of exactly why you're doing anything all the time. But when you can stop and do that, you can do that retro analysis, and it can help you understand that process and then make changes in the future to incorporate that into your behavior repertoire to kind of avoid those things that you would like to avoid or to change. Oops. So a way this might look for DMD might be the event, your boy starts to fall. Thought, his disease is progressing. Emotion, sad. Thought, this is so unfair. Emotion, anger. Urge, I want to stop them from going up the stairs without being supervised so I don't want them to fall. Thought, it's my responsibility to keep them safe. Event, the boy goes to use the stairs. Emotion, fear. Action, you quickly provide a verbal prompt to stop. But because your emotions during this chain have been sadness, anger, fear, the likelihood of that verbal prompt coming out in a way that sends the message to your child that you're worried and you want them to be safe is less likely than it is going to come across that you're angry and upset and yelling, right? Because that's what happens when we're afraid. And so it's not intentional, right? And this is a fairly normative way to kind of go through this process. But when you're wondering, maybe why does my kid think I'm yelling at them when I'm not? Analyzing it this way might help understand why your tone maybe wasn't what you thought it was, but perceived in this way, right? Because these are nonverbals, and the majority of our communication happens nonverbally, in tone, in rhythm, and how we say things, right? So it's not really what you say, but how you say it. And that might be perceived by somebody in a way where then they're telling themselves, you must be mad at me, right? Versus they must be afraid. And so it's important this analysis is important for understanding or being able to look back at your process, particularly in relation to your kids as you're helping them learn how to cope and how to kind of think about the things that are happening to and around them. Negative emotions, right, are going to exacerbate any underlying process that's occurring, right? So grief and anxiety can serve as contexts that are going to kind of throw jet fuel on any underlying thing happening. So if you're already baseline anxious, or you're already baseline depressed, or you're already somebody that's like more prone to being sensitive to stimulus, when you are anxious about an external factor, like your son or your daughter or your loved one, that is going to kind of make that louder inside of your body. And how we respond to that's really important, because it's okay to not be okay, but we just don't want to get stuck there. We don't get stuck doing the patterns that we do when we're not okay, because then that's where we develop, bona fide mental health conditions versus normative reactions to abnormal life events, like your child being diagnosed with a rare neuromuscular genetic condition without a cure currently. So if we revisit our first example, and we add an anxiety or a grief component to that, right? Like maybe you're just told about diagnosis, or maybe you're anticipating starting to lose ambulation in the next little bit. And these same examples happen, okay? So let's say the same examples that we were talking about earlier are happening, but now we have this additional context in place. The places where you might see yourself change, or you might not send them to the room, because you might have a bigger window where you're like, you know what? They can't really help it. They have this horrible condition. I don't want them to feel bad about it. So I'm going to give them a pass on that. Okay. I'm going to let them off, and I'm just going to be like, hey buddy, we don't yell. Okay. Like just keep doing you, or I'm going to ignore him. And what happens is then these really negative behaviors can kind of develop and persist, right? Or these learned behaviors that the boys might be gauging in over time kind of get worse, right? Because now we're allowing it to happen, and we're not necessarily addressing it in an adaptive way, because our own emotions, because we feel bad. This bottom one, you might not have this thought, right? So it might be protective in this instance, right? I know they're not doing it on purpose, right? You might have something there, and it might not make you feel angry. You might actually feel something else, like despair, right? Like they can't help this. This is a lot. This is forever. And you might feel a different emotion. And that's going to then change your subsequent interactions, right? With your child or with other people. And so it's not necessarily about, doing this all the time so that you can, prevent these things from happening, but sometimes understanding emotional processes and how they serve as context for why you might respond a certain way in the future can be really helpful, especially if you notice you're starting to develop a pattern that you want to change. I don't like how I'm interacting with people. I don't like that I'm being snappy. I'm noticing that I have a shorter fuse. Okay, so understanding how you get there can be very, very helpful. And this is a really a process that you can do by writing things out and helping yourself identify sort of how these things are chaining together. And we want to do this so that we know where we need to intervene, right? There are physiological strategies like the physiotherapist Sarah's talking about. Yes, physical things are great for physiology and for helping improve mental health in general. Breathing, progressive muscle relaxation, exercise, right? So sometimes if you're feeling really keyed up or you're feeling anxious and you notice that, and you notice those patterns, right? You might not feel it in your head, but maybe you're noticing yourself do the things like I'm not eating as much. That's mine from yesterday. That maybe tells me I maybe need to do some more to help my body feel a little bit more calmer, because I do best with physical activity. Cognitive and thought interventions, like thought challenge and restructuring, I talked a lot about that yesterday. Mindfulness, acceptance can be really helpful, from helping us accept the feelings that we're having and helping us understand maybe how we can catch and change thoughts that are exacerbating that internal experience or keeping them here. So remember, emotions are fleeting. They might be fleeting, right? Where we get in trouble is if we start to engage in thoughts that fire and activate them and keep them happening, right? So we don't want to stay in that loop. We want to let our emotions be fleeting and then leave. The best way to think about this is think about thoughts, feelings, and emotions as the sky and like the planet. So we're on planet Earth, and you can see the blue sky if you go outside. There's clouds kind of happening. If there's a storm, we might have a blanket coverage, okay? And we know that above that, though, the sky is blue. So emotions and thoughts are that blanket coverage, that storm. And sometimes you can't see past the storm, right? Like the storm goes in every direction. It's probably the whole world, it might feel like, and the storm's really bad. But if you've ever flown during a storm, you get above that cloud and you know that the sky is blue, okay? Emotions and thoughts and feelings are like that. They are fleeting. They might seem very big, right? But they will pass. And where we get ourselves in trouble is when we are doing things that don't allow them to pass, don't allow them to fleet and to have that experience. And so when you're in that time, if you're really struggling, remind yourself, like, I'm experiencing a storm. And I know that above that storm, there's clear sky. And the storm might last for a bit, right? Some storms are really bad. There might be some damage, right? Like hurricanes could be horrible. but there will be relief from that if we allow it, and we don't want to stay in that storm forever. And then we need to be preserved so that we can do the repair work we need to fix whatever damage was caused by that storm. For feelings, gratitude exercises can be really helpful, and it could be a form of opposite action. And so let's say you're feeling really angry or feeling very sad. One thing you might do is you might do something nice for somebody else, even though you might not feel like doing that, because what we know is when we do that, we naturally produce chemicals in our brain and feelings that counteract that. And so it blunts that other emotion, right? Because you're getting this secondary. So it's a way to kind of trick your body into feeling better by doing things that are in opposite of how you're actually feeling, to force that emotion to come, or that other emotion to come. So when we talk about acceptance, I'm not talking about agreement or resignation. So acceptance is not saying, well, if you can't do something, just accept it and be over it, right? Like, just accept it is what it is. That is not what we're saying, okay? That's false. What acceptance is acceptance is the willingness to experience psychological events without having to avoid them or let them unduly influence your behavior, okay? It's acceptance of the internal experiences that accompany whatever is happening in life that you do not have control over, rather than acceptance of the situations evoking them, okay? So acceptance that I feel angry and I don't like having Duchenne and this sucks and I hate it is different than accepting that, well, it's Duchenne, it is what it is, there's nothing we could do about it, and we just have to be okay with having Duchenne. Those are two different things, okay? This is a community that fights every day against the Duchenne piece, right? The piece that this helps with is that internal process of how it feels to fight that battle and to live life when there are things that you're dealing with that are outside your control, that no matter what you do, are not necessarily going to be in your control immediately, right? Or without the help or need of other people. So control is really the problem, it's not the solution. And our attempts to control as humans are really what cause us the most suffering. Because when we try to control, we produce some minimal benefits or some temporary relief, but over time what that happens is it actually makes all those experiences a lot worse and a lot harder to actually manage. And that's where we really get into this concept and process of how do we develop suffering, and then how do we maintain suffering in our lives when we don't want to, right? Nobody's over there being like, oh my gosh, I can't wait to suffer so hard today. It's not, how we are as humans. So we think about control, and we want to I'm just making a plug quickly because it's an easy way to do this, is that you don't have control over how other people treat you. You have control over your expectations of how you respond to how people treat you. You don't have control of your emotions, but you do have control over whether or not you choose to regulate your emotions and how you choose to manage your emotions. You do not have control over the results of your effort, but you do have control of how hard you cope and how hard you work to improve things. You don't have control over what people think of you, but you do have control over how you speak to yourself and how you allow yourself to kind of interact with things happening to you. You don't have control over the past, but you do have control over the choices you're making right now in this given moment. You don't have control over how others behave, but you do have control over the boundaries that you create and the limits that you set and how you allow people to treat you and interact with you, right? Like, you can set your limits around that and choose not to interact with people. This is where we can work, right? This is what acceptance is about. It's about shifting into spending less energy and effort into those areas that we can't control, that really trying to control and striving in those areas causes us suffering, into places that allow us to adaptively cope and live life and function as best as possible while this other thing might be happening. So it doesn't mean you're going to feel good about it or happy all the time, but it's saying, regardless of this, having Duchenne, can I live the best life possible, have the best quality possible, and adaptively manage my internal experiences, which are very hard at times, in a way that lets me continue to progress and move and not stay stuck and kind of in a place that I'm not my best self or a good version of myself. Thank you.
Natalie, thank you so much. And Natalie's available for questions. Do we have any online questions for Dr. Truba? Anything from the room? Okay.
Keeping it easy, I like it.
That's good, yeah. Well, thank you so much for joining us, making the trip. Have a safe drive home to Columbus, Ohio. Thank you, Dr. Truba, again, very much.